Hello. Now, I'm sure that even if you've never seen the film Life of Brian, you will have had recounted or quoted to you the famous scene where they sit around and say, well, what have the Romans ever done for us? And of course, there are lots of answers. The Romans provided roads, food, entertainment, theatres, and a quite well-organised army. Over the last few weeks, I've been wondering what the National Programme or Connecting for Health has done for me. Well, there are some answers. Yes, we've got NHS Net. Yes, we've got the GP systems of choice. But after that, there's not actually anything very much we use in the practice. It doesn't have a very big impact on primary care. Yes, there were things like Choose and Book, but we haven't used that for years because simply it was too appalling. And constantly coming out with the argument that it's working to specification when it's plainly terrible was somehow unhelpful and somehow missing the point. Connecting for Health somehow saw itself as the customer rather than a wholesaler. Now, things are probably improving, but there seems to be a sort of lack of vision at the moment. I remember when the first output-based specifications leaked out, they were dramatic, really quite exciting, really quite ambitious. Okay, they needed changing, there were significant problems with them, but at least they showed some vision. What they didn't say was we were going to slightly change the contractual arrangements for general practice systems and set up a small internet service provider. That just seems a bit dull. And so what can we do to change? Well, as Connecting for Health sees itself as a wholesaler, that means it has to buy well. But it has to sell as well. It has to produce products that people want to use. And simply saying that it's working for specification isn't going to be good enough. And actually, I think these changes are happening. They're happening too slowly, and they're certainly not going back to old projects to have a look. Choose and Book 2 would be a fantastic thing if we could all get round and decide what it's actually going to do. Electronic transmission of prescriptions. If we could sit round and work out something that worked and give a sensible method of doing so, then that would be great. And even the NHS spine and the slightly shaky on-off, will it, won't it patient summary record could really benefit from starting to re-engage and possibly starting at least at a user level with a clean sheet of paper. I honestly hope these things are going to happen, but with the current upheavals in the NHS, I really wonder whether they will.